So you've heard about macular degeneration, and you probably know that it's often described as age-related macular degeneration. In this video, I'm going to explain exactly what it is, and also whether it's just an inevitable part of getting old that we all just simply have to live with. Hey, what is happening? My name is Martin Oguzie and this is Martin's Eye Tips. Thank you so much for joining me. If you're new here, please think about subscribing to the channel. On this channel, we're all about giving you eye care tips, how-to videos and product reviews, all designed to help you see better, see more comfortably and be less anxious about your eyes. So let's get started with today's video. Now, if you know anybody with age-related macular degeneration, you know that it's quite a devastating condition to the person's vision and also to your lifestyle. However, for my peace of mind point today, I just want to remind you of the fact that macular degeneration is something that affects the part of the retina that we call the macula, which is located centrally in the vision. And what that means is that although you're going to lose potentially your central vision, you'll always have your peripheral vision there as well. So you're not going to be in total darkness. Now, while that may not be the most comforting thing to hear, it's still something that is vitally important to keep in mind, and it does reassure many people of the fact that you will still have a vision that is still functional and is useful for certain things. Having said that, as an optometrist, I come across many people who I see for the first time who have had a diagnosis of macular degeneration, but nobody's ever told them that they should be taking action to try and limit the rate of progression or to delay the development of the most aggressive and advanced stages of macular degeneration. So what is macular degeneration? Now, when your optometrist or your ophthalmologist has a look at the back of your eyes, there are a couple of key landmarks that we look out for. One of the most important is the area called the macula. Now, it looks like a red dark spot, and the reason that it looks like that is because it has lots of cells packed in there for high definition vision. This area is also concave, so it kind of bows in a little bit, and this combination of features gives it that darker looking color. Now, macular degeneration itself is a general term that describes anything that causes a degeneration in that macular area. So one of the most common types of degeneration of the macula is what we call age-related macular degeneration. Now, the term age-related macular degeneration is a little bit deceptive, I think, in that it makes it sound like we're all going to get macular degeneration as we get older, but in actual fact, most people will not. So the fact that it's got the name age-related macular degeneration helps us to distinguish that it's not due to other forms of degeneration that can occur due to other disease processes. So to help us understand a little bit about what goes on in the age-related macular degeneration process, let's have a look at the structure of the retina in the macular region. So the innermost layer that's most relevant to this discussion is called the photoreceptor layer, and that's made out of your rods and your cones. Then further out we have the retinal pigment epithelium layer, which is often abbreviated to RPE layer. Then further out we have a membrane layer called the Bruch's membrane. Then further out from that is a vascular layer called the choroid, and the choroid is just a bed of blood vessels. Now, to explain age-related macular degeneration as a process, it's worth starting out at the RPE layer. This layer is a highly important layer because it helps to nourish the photoreceptors, but it also has function in absorbing UV and blue light, so protecting deeper layers further out into the retina structure. Now, as part of the normal kind of metabolic process and the work that this RPE layer does, it does create debris over time, which normally would be pushed out to the space between the Bruch's membrane and the RPE layer. Now, for whatever reason, perhaps due to age, some of this debris that builds up doesn't get moved along, but instead builds up in the Bruch's membrane and also in the area between the Bruch's membrane and the RPE layer. As a result, the Bruch's membrane starts to alter in thickness and starts to develop an irregularity about it. And this then starts to affect, as well as with the RPE, starts to affect the performance and the health of the RPE layer. The result is that the retinal pigment epithelium cells will start to die off, and when they die off, then you start to over time get to dying off of the photoreceptors that lie above the RPE cells. Now, as eye care professionals, when we start to see the yellow deposits that we call drusen in your eye examination, then this is an indication of macular degeneration. If it's only drusen that we see, then this is what we call dry macular degeneration. Now, when dry macular degeneration progresses, then it may initiate an inflammatory response in that area of the retina. And the inflammatory response starts to kind of initiate a range of processes, one of the most important of which is the releasing of growth factors. And the growth factor then causes the choroid to try and develop new blood vessels. Now, this is quite a significant event because new blood vessels that grow from the choroid area will try and come and supply additional blood flow into the affected area. And when this happens, it's a problem because these new blood vessels are not well formed. They are micro blood vessels and they're not really capable of supporting the blood flow through them. As a result, these blood vessels will leak and will start to bleed into the retina and into the macular area that has been affected. And when this happens, this then progresses to a type of macular degeneration that we call wet macular degeneration. Now, the distinction between dry and wet macular degeneration is the fact that the dry type only has these yellow deposits, which over time themselves can be harmful as well, because the photoreceptors in that area will start to degenerate and die off because it's all been affected by this buildup of this deposit that we call drusen. But the wet type is when we start to get these new vessel formations that leak, and the leak then is a real problem to sight, because all of the area where blood is leaking starts to die off really quickly and leads to a very rapid loss of vision in that area. So in terms of categorizing the stage of development of macular degeneration, there's effectively four phases. So first of all, there is phase 1, where you have no presentation whatsoever of any drusen, these yellow deposits. So for all intents and purposes, your retina is normal and your macula is normal. Then you have stage 2, which is the early stage, and in this stage you may just have a few scattered small yellow deposits of this drusen material. Now the next stage is the intermediate stage, where you may have even just one medium-sized drusen, or you may have a few medium-sized drusen in that area. And then the latter stage, stage 4, is the advanced stage, and at this stage we may see bleeding. We may also see lots of drusen, causing what we might describe as a geographic atrophy in that area. So these kind of processes signify that you've got to this advanced stage, and certainly at the most advanced stage, level 4, we'll be seeing dramatic impact on your central vision. Now, when it comes to treatment of macular degeneration, it's important to note that there's actually no cure for macular degeneration, and that's true whether we're talking about the dry type or the wet type of the condition. But what there is for people who have the wet type of macular degeneration, it's critical that the bleeding is stopped, because areas that are affected with this blood are vulnerable to a rapid dying off of the cells in that area. So the treatment that's available is twofold really. So first of all, there's an option which involves laser, and this laser is designed to just seal off the area that's leaking. The downside of this treatment is that it is a destructive treatment, and that's to say that the area where they blast with laser, effectively everything dies off in that area. So you don't want to be doing lots of lasering because you're effectively damaging a sensitive area, and a small area as well in the macula. So the alternative option is an injection with a type of a medication that is designed to stop the new vessel forming. So these new vessels which form and leak, then the injection halts that process, and it's proved to be highly effective in stopping the progression of the bleeds and also new vessel formation, which then means it preserves people's sight for the long term. And when I say long term, that is with the proviso that you continue to have this procedure done roughly about every 12 weeks. Now, when you get the diagnosis of macular degeneration, it's always important for us to consider what stage you're at in the process, because this may have an impact on the treatment that's going to be most relevant to you. But also it's important because in the early stages, then you definitely should be taking proactive measures and steps to try and delay the progression of the condition, or even to stop it advancing to to a level that really impacts your sight. Now, research has shown that one of the most effective ways of doing this is through nutrition. So if you're somebody who is certainly at intermediate stage, then you need to be taking the necessary nutritional steps to be able to help your eye and protect your macula as much as possible. And this may mean that particularly if you are in the intermediate stage, it just may be more straightforward for you to go straight onto taking supplements that contain all the necessary vitamins, antioxidant vitamins, and minerals as well. Research, the leading research on this is the AREDS study, and the latest version of this study is the AREDS 2. So on the screen right now is the recommended composition of the supplements that you should be taking to have the most effective benefit in protecting your eyes from macular degeneration and the advancement of vision loss. Now, even if you don't have any presentation of macular degeneration, in fact, we all really need to be taking these ingredients into account in our daily meals, just to protect our eyes as much as possible. Now, while macular degeneration is described as age-related, it's certainly by no means guaranteed that we're all going to get macular degeneration in later life. In actual fact, most people won't get macular degeneration. So it seems to be the case that you may be more vulnerable if you don't have a good intake of certainly lutein, zeaxanthin, because they are found naturally at the retinal pigment epithelium layer in your eye, and there's evidence to suggest that having a low dietary intake of lutein and zeaxanthin and meso-zeaxanthin, then this can lead to your pigment density being lower than it ought to be. And low retinal pigment epithelium density is associated as well with higher damage from UV light and blue light, and this then can lead to some of the factors that lead to macular degeneration progressing and developing later on in life as well. So for my tip of the day, I would say that if you're somebody at the intermediate stage of macular degeneration, you ought to be taking supplementation as well as eating well generally anyway. This then just helps to make sure that you're getting the right formulation of these antioxidant vitamins as well as the minerals recommended by the AREDS 2 study, just to give yourself the best protection going forward. And if you're somebody who doesn't have any presentation of macular degeneration, or perhaps you are in the early stages, or you've got a family history of it and you're concerned, then looking at the nutrition in your day-to-day diet is an important kind of adjustment to make, just to make sure you're getting plenty of the ingredients that contain lutein, zeaxanthin, meso-zeaxanthin, and a lot of the antioxidant vitamins as well, so vitamin C, vitamin E, and including as much of that in your diet as possible. So that then just helps to make sure that you're doing everything you can from a nutrition point of view to protect your eyes going forward. If you found this video helpful, then please think about subscribing to the channel, hit the notification bell, and also like and share this video as well. That really helps out the channel. Also look out for my next video, which I'm going to post up here if you want tips to help you with nutrition to protect you from macular degeneration. So I look forward to seeing you in that video. Take care.